Hello, Nahara members. This is Janet Borland, Association Director of Nahara, and welcome to Learning on Demand with Nahara. Today, I am so excited to announce that we are having Blue Cross Blue Shield of Oklahoma with us today, and they are going to be talking to us about how Blue works for all of us. In the call today, we have Nova Hammersley. She has began working with Blue Cross Blue Shield of Oklahoma in 2004 and is currently serving as the Senior Director of Sales and Account Management. As a daughter of immigrants, Nova has a passion for creating a diverse and inclusive work environment. Nova holds a bachelor's degree from Oklahoma State University and a master's degree in business administration from Southern Nazarene University. Welcome, Nova. We're excited to have you. And joining her, we have Lucinda Myers. Lucinda is a citizen of the Muskogee Nation and is the Tribal Relations Specialist for Blue Cross Blue Shield of Oklahoma, where she works with Oklahoma tribal nations, tribal health facilities, and tribal serving organizations to improve access to care and the overall health of Oklahoma's Native American populations. She has a Master of Social Work degree from the University of Oklahoma and has dedicated her career to work in Native American communities. Everyone that's on the call watching this, you are in for a treat. It's a great presentation, and I am going to pass it over to Lucinda.
Hello, Janet. So Istongo Volecka, Mojanita Alagayas, Ajafachkidos. So I said, how is everyone? And I am so happy to be here today. Thank you for joining us. Again, my name is Lucinda Myers. I am the Tribal Relations Specialist for our Oklahoma plan. And in that role, I help build our partnerships with Oklahoma's 39 tribal nations and over 60 tribal health facilities across the state. Today, I will share a little bit about what we are doing as a company to build our partnerships with tribes and tribal serving organizations. And my hope is that this will give you some information, some insight on ways that health insurers can be valuable partners in your community. Then Nova will present on our health insurance offerings, which I think you will find valuable as some of the offerings are tailored to our Native American customers. So a little bit about who we are. Blue Cross Blue Shield of Oklahoma is a division of Healthcare Service Corporation, the country's largest customer-owned health insurer, which operates plans in Illinois, Montana, New Mexico, and Texas, and then of course, Oklahoma. Our mission is to connect Oklahomans to quality health care through every stages of life. We believe Oklahoma customers and employers deserve the best of both worlds, access to affordable quality health care and top-notch service from a company that focuses solely on Native American on customers. We live, work, and play and seek care in the same communities as your own employees. So this provides us with a unique perspectives on the local challenges of healthcare and a strong personal drive to address them. So I have been with the company for almost 10 years. It will be 10 years in January, and have found, we share a common goal with our tribes and our tribal serving organizations, and that is we want those that we serve to live a healthy life. So working together for a common goal and sharing resources makes a lot of sense to improving the health and wellness of our communities. There are about 1.2 million Native Americans that live in the 5 states where we offer health coverage, with more than half residing in Oklahoma and New Mexico. And we currently insure over 122,000 Native Americans in our 5 plan states. And so I want to talk a little bit about our business resource group. Our success is our people, as our company reflects the populations we serve. We have our Native American Business Resource Group is one of 9 business resource groups within our company. And our employees represent various tribes. They bring different perspectives and life experiences to our company, and they help guide our work in tribal communities. So here are a few focus areas for our Native American Business Resource Group. It supports our Native American employees and helps them thrive in their careers. This gives them that support system, and it provides professional development opportunities to help them in their career. We also our members serve as brand ambassadors to promote health insurance coverage. So we provide, we have our members, we work together, we do a lot of volunteer work out in our communities. Our employees know, our communities, so they're able to speak to their loved ones, speak to their family members, those that they know about health insurance and the importance of health insurance. I think having a trusted person to provide education is vital. And we serve as a resource and give company insights into the health and social challenges of tribal communities. So I wanted to share just a couple of tribal resources that we have created, and we do run this by our business resource group and get their input into some of our collateral. We have a tribal nations awareness training that we provide to our employees across all 5 plan states. The training educates our employees on tribal sovereignty, health disparities, including root causes and how they continue to impact tribal communities today, information on existing healthcare infrastructures, and best practices in working with Native Americans and tribes. And our employees, they give input and help customize communication for our tribal members and groups in a culturally sensitive and respectful way. So each collateral we have across our plan states, they represent each state with local imagery, and they're vetted by our tribal partners. So every collateral we create, whether it's health insurance choices for American Indians, we have our input from our tribal partners on these collaterals. And another resource that we have within our company, we have a tribal relations work group. We meet quarterly, and it is all 5 plan states, all lines of business. We come together, we talk about best practices in working with our Native American plan members, and we share resources. We think, it's very important that we communicate within our company and to ensure that we meet the needs of our Native American plan members. And let me change. And building some of our partnerships with our tribes across our 5 states, some of the things that we believe that we must be present in our communities, have a seat at the table. What I do here in Oklahoma is I am a part of several tribal health initiatives. I'm at the table learning about what are some of the needs that our tribes have and how can we partner with them to address those needs. We also have a in-person annual tribal meeting with tribal leaders, tribal health directors, and patient benefits, billing office. So anybody within the health system, within tribal leadership, is invited to attend our tribal roundtable. We bring in our leadership. We talk about pertinent health issues that are impacting communities here in our state. And it's a great discussion that we have. We will be having our 12th annual Tribal Roundtable next Tuesday on September 17th. So we're looking forward to having a great discussion with our tribal partners. Like I mentioned earlier, that we do a lot of volunteer work. We work with our urban Indian clinics in Tulsa and Oklahoma City. We do participate in their youth programs, their wellness events, and other outreach things that we do in our community. We do have a health insurance enrollment team that works with several of our Indian Health Service clinics, and they provide health insurance enrollment events. So we do a lot of partnerships with our tribal clinics, ensuring that we work together to share the same message on health insurance. And wanted to talk a little bit about our Oklahoma Caring Foundation. So the Oklahoma Caring Foundation is a 501c3 organization administered as a in-kind donation by Blue Cross and Blue Shield of Oklahoma. They provide access to preventive health services, primarily to children. Services are free of charge for low-income and Native Americans, and in Oklahoma, we have 3 tribal vans operated by the Choctaw Nation of Oklahoma, Chickasaw Nation of Oklahoma, and the Southern Plains Tribal Health Board. And they are able to provide a variety of services, not just immunizations, to the communities that they serve. I mentioned our tribal roundtable next week. The Southern Plains Tribal Health Board will be celebrating their 10-year anniversary of having a van. And here are a couple of the services that they offer. So glucose screenings, cholesterol screenings, fluoride varnishes, so a variety of services that are offered on our vans. With that, I would like to pass it over to Nova, who will be talking about our tribal solutions.
Thank you very much. All right, so I'm going to talk about the tribal solutions that we've spent several years developing and the why behind it. Lucinda, can you go to the next slide, please? All right, so to give you some context, I'll give just a quick overview. Currently, we have 81 tribal groups with about 87,000 members in our 5 states. These numbers represent a tribe or an entity owned by a tribe. We also have over 30,000 individual tribal members across our 5 states that are not on a group plan, but have purchased a plan on the marketplace. Oklahoma currently administers medical plans for 33 of the 38 federally recognized tribes. We'd love to have them all. But because of the number of tribes we serve, the large tribal population across our 5 plan states, like Lucinda mentioned, and the unique needs for the tribal populations, we developed a new suite of services with Luminaire that we're really excited to share today. I'm sure that many of you also heard about Tribal First, who we partnered with because of their vast experience in the tribal market to guide us through the development of this solution. Next slide, please. All right. So as I mentioned, we partnered with Luminaire Health, which is a subsidiary of HCSC, to bring forth our solution. This is not an outside solution, meaning we are not outsourcing the administration of Medicare-like rates. While Luminaire operates in our core 5 states, they can still quote this tribal solution nationwide and partner with other Blues plans for the network component. So a little bit about our approach. Our approach is not a one-size-fits-all, but rather understands that each tribe is unique and has a unique healthcare ecosystem that we are able to support through integrating the tribe's programs and solutions. We support the PRC program administration and the reporting of Medicare-like rates. We do have a unique plan document and contracting language to support tribal sovereignty. Our contract does include tribal exclusionary clauses, which we know is important. We also hear that our competitors don't include that language. You can see that we provide reporting for CHEF, we administer payer of last resort, and we coordinate sponsorship programs. Our coordinated care solutions address the whole person and not just one condition or illness, and I'll talk more about that here in a few minutes. Our claim savings have lowered our customers' overall spend by ensuring that we help members reach the right care at the right time, at the right place for the greatest value. We do have a dedicated 1-800 number for our tribal members, ensuring that we have an educated team who has an understanding of tribal care programs and can support the member to ensure they receive the best care from the highest quality providers and support the members with the timely responses to questions so that they reach a positive outcome. This solution can be paired with a PPO plan, a high deductible plan, and each plan can be adapted to fit the different needs for tribal employees. It cannot be paired with an HMO because it does have to be self-funded, and we don't self-fund HMOs. These plans can be customized with respect to tribal sovereignty and address specific healthcare challenges faced by the Native American population, such as higher rates of diabetes and heart disease. We have groups today that have anywhere from a $0 deductible to a $5,000 deductible with a wide range of services covered. For instance, some cover GLP-1s and some don't. But the bottom line is that all of it can be tailored to meet your needs. Next slide, please. So our partnership with Luminaire means that you get their claim adjudication platform and customer service, and then the Blue Cross network. So in addition to covering your employees and their families locally, our national presence ensures that regardless of where a member travels or receives care, that they have confidence that with the Blue Cross network, they will have in-network care, which is easy to access. We have you covered in 50 states and nearly 200 countries and territories. Your employees and their covered loved ones will have access to over 2 million providers and hospitals across the nation, regardless of where they are. It's more than any other insurer out there. At least we think it is. Nationwide, we pay 98% of members' claims at an in-network rate versus our competitors, which is about 94%. We believe that this is why 1 in 3 Americans are covered by a Blue plan today. We also ensure members have access to culturally sensitive and locally available care by contracting with all tribal clinics and tribal-owned hospitals in Oklahoma. Next slide, please. All right, so we know that visiting a brick and mortar provider is not always feasible. Because of that, we have a robust telehealth program available that allows you to speak to a doctor or therapist 24/7, 365 from any location. Prescriptions are instantly sent to the member pharmacy of choice. And telehealth really does save money by costing less than urgent care or an ER visit. And the best part of it is you don't have to sit in a waiting room full of sick people. You can do this from the comfort of your own home because all appointments are private and secure. Next slide, please. Okay, so a little bit about our care management solutions. The life expectancy for American Indians is more than 5 years shorter than that of other U.S. races. Native American women have a 7% higher cancer rate compared to non-Hispanic white women. And Native Americans are 2 times more likely to have diabetes than non-Hispanic white Americans. These are just a few examples of why we created care management solutions to meet the needs of tribal populations. We have dedicated and experienced case managers, several of whom are located within the states of tribal populations. Many have experience in taking care of tribal members and a staff experienced in delivering home care nursing within tribal populations. We have focused case management programs for chronic condition and specialty case management that addresses the health disparities in the tribal communities. We have tribal-specific resources to support access to care by incorporating complementary and alternative care approaches and social determinants of health services. We have the ability to collaborate with local providers, including Indian Health Services, tribally owned clinics, and urban clinics to provide coordinated care. And as far as cultural awareness, we augment our staff skills through cultural and sensitivity training for all team members, including tribal sovereignty, Indigenous peoples' history, and health equity and communications. We do have an integrated approach to tribal population and social determinants of health focused on community-specific needs to target member-specific assessment needs. Next slide, please. All right. So our wellness program, Well on Target, provides members and clients with a more robust and integrative way to experience wellness. So we really like this because members can engage when they want through the channel that really meets their needs. We have a dynamic Well on Target portal that's designed for a personalized experience. This is my favorite part, and that is that we have these blue points that are built in to reward members to create and encourage healthy behaviors. So members can earn and redeem points for taking a health assessment, for enrolling in a self-directed course, or using an activity tracker and a host of other activities. And blue points can be redeemed for merchandise. This is at no cost to the plan. We have easy to access wellness features through the Always On mobile app. So the mobile app allows for members to take a health assessment and use a tracker right through their phone. We have fitness and nutrition device app integration for constant motivation, and we have online wellness challenges. And basically, it's an online personal wellness challenge that's available to all members, and these challenges last up to 6 weeks with varying wellness-focused goals. We have personalized wellness communications for additional encouragement. We have electronic communications that use the data that we have on hand for our members to tailor the communication pieces to basically drive engagement into our wellness programs. And then we have employer tools for promoting on-site wellness and hosting workplace competitions. So we have an on-demand portal that holds a range of marketing collateral available to you, from wellness calendars to flyers to email templates for promoting events. The on-demand portal also houses aggregate reporting showing utilization for the program, and it's specific to your population. These reports are updated weekly, and it's important to be able to see the utilization so that you know where to focus your challenge or where to focus your communications. Next slide, please. All right, so we wanted to share a few ways of how we've connected groups and members to innovation and education. So one of our solutions prior to the partnership with Luminaire and being able to adjudicate Medicare-like rates was we developed a network called Native Blue. And Native Blue was a solution to meet the needs of the tribes that wanted to use the MLR capability, but couldn't with us. So we developed a Native Blue network. It was a narrower network, but this network allowed for 100% coverage for all employees, meaning no deductible, no co-insurance, no co-pays. You had 100% benefit. Because it was a narrow network, it worked out that way. The discount savings increased from 67% to 76.7%, which is a little over $5 million in additional savings to both the client and the employees. And this was in year one. This is for an current Oklahoma tribal client. So another way of connecting members was care management and program support. So we had a member who had 2 inpatient admissions, back-to-back admissions for the same condition. The Blue Cross case management team provided support with the following. They had specific discharge planning that included social determinants of health, ensuring that the member had access to support and local services. And then they assisted with finding a network home health provider. This basically helped not to have a third admission for this member. And then we love our health fairs. We partnered with a local Oklahoma tribal client, and attended over 10 health fairs over the course of 3 weeks. We created educational opportunities, promoted services and tools that are available around health and wellness that I just discussed before, education around health insurance, and assisted individuals that are not part of the tribal group with individual coverage through the exchange. So I mentioned we have a little over 30,000 members today on the exchange. And so during these health fairs, if a tribal member comes up to us and is not on the health plan but wants to have coverage, we assist them in getting that coverage. And Lucinda, I think that might be it. Yes. Thank you so much for joining us today. Our contact information is on this slide. If you have any questions about any of the content we talked about, please feel free to reach out to either one of us.
Wonderful, ladies. I have a question though. If say if I'm in the market in order to work with Blue Cross Blue Shield of Oklahoma, I have to work for a tribe in Oklahoma, correct?
Correct.
Okay.
Mhm.
So tell me a little bit about, so let's say you work with all entities, correct? You work with
Mhm.
the casinos, you work with the
Mhm.
development corporation and
Yes.
tribes, right?
Mhm.
So what makes you different than the other organizations other than Blue that are out in Oklahoma? Working, and myself, I used to work for a tribe, and you see the different types of generations that are in an organization. So does Blue Cross Blue Shield, and I love all the wellness programs that you have. So it's kind of like a three-tier question.
Mhm.
Question number one would be, do you offer services in other languages? Because in casinos, it's so culturally diverse. Do
Mhm.
you have other languages that people can look at portals? And then two, do you have um a an app for an organization to use that is dedicated to the team members of that organization?
Mhm. Yep. Okay, so I'll take the first part. Do
Okay.
we offer services in other language through our portals? And not through our portals, but we do have a language line. So if a member was to call in to customer service, we do have bilingual members, but then we also have access to a language line that we bring in so that the member doesn't have to worry about trying to tell us something in a way that, you know, in a language that we may not understand, or struggle through trying to tell us something in English that they're not very well at. So we do have the language line to help us.
Excellent. Okay.
The second question was, do we have an app for our organization that's dedicated to that specific group? And yes, we do. We have an app for the member through on their phone. They would log in. They could see literally everything. They could see their claims. They can see prescription information. They can see anything from a prior authorization, whether it was approved or not. If they are on a high deductible health plan, they can see all the spending. If they do participate in an HSA, they can see that, those amounts. It's a very robust app that we have. They can also look up providers on that. So,
Okay.
yep.
That's wonderful. So let's say I am in an organization in Oklahoma
Mhm.
and I currently have a plan right now and I'm, going into a new year. Would I reach out to the both of you to say, hey, listen, I'm currently with this benefit plan right now. Do you think you can look at my organization's plans and help me out? What is it that I would need to do to have Blue Cross Blue Shield look at my organization, or even look at what what current plan I am now, what I'm spending on,
Mhm.
what's my risk?
Mhm. Yes, we can do that. The process would be to reach out to me, and my contact information is there. If you are looking for the possibility for Blue Cross to administer your plan. If you're currently on Blue Cross, you have a very robust account management team who can do all that for you. They can model anything from changing your deductible to adding certain services. But if you are not currently with Blue Cross today and you're interested, you can reach out to me and we can take a look at what you're doing today and come up with a plan, whether it be saving you additional money, designing a health plan that meets your needs, anything that you need like that.
Okay, wonderful. Wonderful. Well, Nova, Lucinda, thank you so much. And to our members that are watching this, you have any questions in regards to your plan? You're in Oklahoma right now. Encourage you. The email is on the slide right now. Reach out to Nova.
Mhm.
And also to Lucinda, you have some really great tribal programs out there too. I really encourage you to reach out to Lucinda. Ladies, thank you so much.
Can I
It was
say one more thing,
amazing.
Janet?
Oh,
Do you mind?
yes, Nova, yes,
I wanted
please.
to just say that Luminaire is owned by HCSC, but they can administer a tribal plan in any of the 50 states. So if you're not an Oklahoma tribe or you're not in one of our 5 states, please
Uh-huh.
go ahead and reach out to me if you have any interest, and I can connect you with Luminaire.
Oh, wonderful. Thank you,
Mhm.
Nova.
Yep.
Okay, awesome. Wonderful. Well, thank you so much, ladies. I really
Thank you.
appreciate your time. And for those who are joining us, once again, they will be at the annual conference from September 23rd to 25th. Please stop by their booth. They're also going to have this a really great session at the conference. Childcare transportation challenges, the lack of healthcare access, have a profound impact in workforce. So they will be speaking on the last day, September 25th, from 1:45 to 3 o'clock. I encourage you, if you're looking for a session, join their session. Wonderful.
Thank
Well,
you.
thank you so much.
Thank you very much.
Thank you.